So it's my pleasure to be here with you interviewing. Could you just introduce yourself?
Yeah, I'm a Professor Gisela Terwindt. I'm a neurologist at the Leiden University Medical Center, and that's in the Netherlands in Europe.
Great. So we are going to talk a little bit today biomarkers on migraine, and today and in the future, maybe near future. And I want to know a brief overview of what are your thoughts about it?
Yeah, well, of course, biomarkers is a very broad concept. I started when doing my PhD that we were looking at genetic markers for migraine. So we discovered the first gene that is implicated in familial hemiplegic migraine. And this kind of research on biomarkers and genetics was actually aiming to get more insight in the pathophysiology of migraine, and that could actually be very helpful. But what I presented at the International Headache Society Congress the past few days is the relation between my biomarkers and whether you can predict treatment responses.
That's very interesting because nowadays we just rely on clinical information. And what you're saying is that we can maybe gather some more information. Which should this information be? Which are the biomarkers that are most important in your view opinion?
Yeah, so I discussed that biomarkers as a broad concept. So I think also clinical features can be regarded as a marker. So I presented some results of our own group at Leiden University, where we, for instance, also looked at clinical features like depression and depressive symptoms. And actually, we showed in our studies that when patients have experienced depressive symptoms, they are less likely to respond to monoclonal antibodies treatments, for instance. I also presented data on allodynia, so the hypersensitivity that people experience during migraine attacks. And also allodynia is a negative predictor for treatment response, not only for the monoclonal antibodies, but also when you look at chronification and whether people with chronic migraine are able to revert to the episodic form. What I also presented is, and that was quite striking actually, I thought was we also looked at questionnaires like locus of control. So how do people perceive whether they are in control of their attacks and whether it's an external factor or internal factors, and also about pain catastrophizing. And actually, we found that people who are highly catastrophizing about their pain and their attacks are more likely to respond to behavioral therapy, which is maybe not that surprising. So if you have a team, and we have a team also including a headache nurse, it can be very helpful to have this behavioral treatment and advice besides your medication treatment. So those are more psychological factors, as you could say. And at the same time, we know that these psychological factors, also like depression, but allodynia is not a psychological factor, but the combination of depression and allodynia is also, they're often comorbid. And the basis of those factors are also the biological phenomenon. So that's why I discuss these factors as well. And beside that, I think there are also what you might regard more as a biomarker, like markers in blood sample when you sample blood or when you do imaging. So we, for instance, showed that if you measure the CGRP in patients and you measure this after 2 or 4 weeks after the start of the treatment, and you see a decline in the CGRP in the blood, the more decline there is in the blood sampling of these patients, the more likely they will be responders in a few months after that. So this kind of blood marker seems also very promising.
And in very early in the treatment, you can predict what's going to happen.
Yeah, that's what we need. So I think when a patient comes to your clinic, they will likely ask, okay, I've heard of all this medication and also this new medication, but will it work for me?
Yeah.
And the patients are not that they don't want to try it. They want actually to know, will it work for me? So I think with the biomarkers, we're aiming for more personalized treatment.
medicine.
Yeah. And only starting this kind of treatment when we actually can predict that people will respond.
That's very interesting because you can actually avoid spending a lot of money because
Sure.
If you start a treatment and you see it's not going to work,
Yep.
maybe you can shift for another one just
Yep.
in the beginning, not maintaining
Yep.
it for a long
Yep.
time.
Yeah. So I think that biomarker research is really important for us as clinicians in the future. And at the same time, I also told the audience when I provided my talk that it's good to know and have in the back of your mind that other factors play a role as well, and these are quite easy to address as a neurologist. So when people have depressive symptoms, you have to pay attention to that as well. Besides their migraine, when they are catastrophizing their migraine attacks, it's important to address that. So also now for clinicians, we can already do something for our patients without the need of this very sophisticated lab biomarkers.
Actually, it's not new. I've been seeing around in the other areas, and you can use that for breast cancer and for prediction of other treatment in the other areas.
Yeah.
So it's very interesting. It's being incorporated in our migraine world.
Yeah.
How far are you thinking we are from that? I mean, when can I order that in the near future?
Yeah. Okay. Well, also Patricia Poserossi, she was in the same session as me, and she very carefully and beautifully explained that some of these measurements, for instance, CGRP, are not that simple. So there is a highly wide variability, and biomarkers should.
Hormones.
Sure. Yeah. So a biomarker should be both valid, and you need to be able to replicate it in your patients. And with that, I think there's much work to do still.
Yeah. Hope we can have a lot of advance in this near future. But for now, I think it's very important for us neurologists to stay tuned with all these novelties that are coming around. And nowadays, we can actually incorporate those scales, clinical scales of depression, catastrophizing, and whatsoever. You use that in your daily practice.
Yeah.
You use that only to maybe have a prediction of what you think is going to happen to the patient, or you use that to select the best treatment. Because you've mentioned that catastrophizing patients, they should be very beneficial using behavior therapy. And how about drugs? You use, for instance, allodynia to choose one or other drug, or it's just a tool for you to predict response of the treatment, whatever it is?
Yeah, so allodynia is not yet implicated in our practice, although we use allodynia to explain our patients about the acute treatments, because there are some beautiful publications also by Rami Bursin showing that if a patient has an attack and allodynia occurs during this attack, triptans will not be working because there is an activation of second and third neurons, and triptans don't work on that. So in my clinical practice, I explain to my patients the need of taking acute medication at the earliest when the start of the attack, and explain them why if you're too late it doesn't work. So I explain the concept of allodynia to all of my patients. Concerning, for instance, depression, well, maybe it's also important to stress, if you do biomarker research, you also have to have a very clear definitions of your endpoints. And you can only define your endpoints when you have validated tools also to assess whether people have migraine attacks, whether it's a migraine day, a headache day. So we put a lot of effort, and it took about 10 years before we developed a validated electronic e-diary, which is time-locked, and in which we can easily assess migraine days, headache days on a daily basis. So this is an application that's not available through the App Store, but it's provided by through the hospital. And with that, we have very clear endpoints for also the validation of our biomarkers. And in this e-diary, we also incorporated depression. So every patient that comes to our to our clinic already fills out a questionnaire on whether there are depressive symptoms. So we also pay attention not only for the migraine, but also for the depressive symptoms. And we decide whether our patients, whether they need behavioral therapy for that, or whether they are in need for medicine. So we have a more broad concept on migraine in general than I think the general neurologist would have.
You've got to understand kind of how the migraineur's brain work as a whole.
Sure. Yeah.
That's interesting.
Yeah. So, and what I like is also in our clinic is that we have. I'm both a practical clinician, as you can imagine, with my depression and allodynia and pain catastrophizing. But at the same time, I'm also a biologist by training, so I'm also really interested in this thorough biomarker research.
Great. One last question.
Yep.
Just looking the present to the future, how you think these wearables could provide some data on biomarkers to be used in a daily practice?
Oh, that's a very good question. So one of the other future plans that, or what we're currently performing in our hospital is maybe start over again. So in the 30 years that I've done research and all the international research has been done, we know exactly what's happening during a migraine attack. And I think the challenge for us is, besides whether medication works, is to predict when a headache attack occurs. And so we've developed a wearable FAP EEG. We call it, how do you call it? A cap, swimming cap, I call it always. And we provide it to our patients so they can measure evoked potential EEGs at home prior to their attack. And we combine that also with their use of their phone. So how much are they using their phone? It's called tachography. And we also aim to add to that also maybe wearables. So I think one of the future challenges for us as international field is to be able to predict upcoming attacks. And that would be great if we were able to do that.
Yeah. I thank you very much. Any final words?
No, but thank you for the interview.
My pleasure. Thank you.